This open bite essentially has happened mostly because of your breathing and tongue thrusting, all habits. Now, if you have to correct it, you will have to do surgery. So we'll have to move the jaw so that the front teeth come in contact, and then we also will have to put you on braces. So it's going to be a combination of surgery and braces. First we'll do surgery, then you need to put braces for maybe 8 months or 1 year, up to that much time. And you can get this, there's a little hollowing of your jaw. So all of that we can get corrected at the same time when I rotate the mandible.
The mandible surgery?
It will be mostly mandible surgery for you, but sometimes I might do a little bit maxilla also. Depending on the movement, I have to plan that. But anyway, it will be a jaw surgery. We cannot correct this without a surgery.
Is it because I'm 21 years old?
Because the deformity is such, yeah, you finished your growth spurt. If you were maybe 12 or 13, we could have tried some interceptive techniques. But now that you've grown fully, we can't do anything apart from fixing the thing with surgery.
So my teeth, this maxilla, the upper teeth is protruding forward. So what about the maxilla?
Upper teeth is not protruding forward. It's just this much is lifted up.
Okay.
So what we actually need to do is rotation. So just imagine it's like this. We need to rotate the upper jaw down and lower jaw up. It's like rotational of both the jaws to close the gap.
Okay.
But when you do that, you tend to get some gaps here. Common sense. So then you might have to put braces to correct all of that. But definitely we can't correct this with braces alone. Impossible. So don't do braces first. It's not going to take you anywhere. Best option, surgery first, braces next. Second best option, no treatment. There's no value of doing only braces. That's what I'm trying to say. You either do nothing or you go for surgery and then braces. With only braces, it's not going to make anything better. It might make it worse. So
my
that's a
upper
plan.
jaw is like this, right? It's not straight round.
It's not, but that's what I'm saying.
There's no other way.
If you have to correct it, it'll have to be surgery first. We can't correct anything without surgery and just braces. But you can let it remain like this also.
But when I'm sleeping, my mouth.
Definitely it will happen. I mean, but you have to understand that we don't have another option in your case. There are people who will suggest to you that okay, we can correct it with braces. Now, unfortunately, it will not be possible. They might say 2 years, they'll do this wire, that wire. I know it will not work at the end of it all. So you go for braces for 3 years or 5 years or whatever time you want, it's still going to be, if not the same, maybe a millimeter or two worse. It's not going to do anything great. Because the problem is skeletal now, it's not dental. Hence we have to address the bony procedure first. That's why I'm saying like that. Because I do get a lot of patients who try braces treatment first, but it's not going to work for you.
So like the treatment is basically just the rotation of the mandible and the maxilla.
Yes, that's what we're going to do first up.
Okay.
We might do a little bit concomitant genioplasty, or those are all things we will decide when we plan for surgery. Because we've got the scan, but
So for the procedure, I'll have to, like, how long will be the post-op?
1 week
1 week.
here, another 3-4 weeks for healing. I'll have to take measurements of your jaws if you want surgery, plan. See, this is only giving you an idea. Now I'm saying with the scan and with seeing you that you need surgery first, braces next.
Yeah.
If you want me to tell you how many millimeters of jaw, what rotation, what advancement, blah, 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 then I have to start planning, I have to start taking your measurements and all that. I do that only when the patient is willing for surgery, because I don't want to do that futile exercise if you don't want a surgery right now, because you might choose to get surgery after 6 months. It's not emergency, you can. You can decide to do surgery after 2 years, after 2 days, 2 months, anything. It's just elective. So because it is elective, so I give you an idea now. You can meet my executive if you want. He'll give you an idea about the costing.
Okay.
Keep everything in mind. Go home, talk, discuss, find a time which is convenient. Then come back for the plan. Then we go to the next level. Otherwise, if we do it now, you will unnecessarily spend money. And then you will decide, oh, let me do surgery after 6 months. When you come back after 6 months, again I'll do the same thing. So again, you'll spend money on those things. So why? It's no use.
So it'll be a single procedure if I...
Yes, I'll fix everything in one go, right?
Okay. And the post-op will be, I'll have to stay...
5 days to 7 days.
And then I can go back.
Sure. You can go back even before. You're in Nagercoil. You can go back after 3 days and come back and see.
I'm in college in Melbourne. It's like 10 hours from here. I came for holidays right now. I only have a week.
No, then we can't do now. If you have a
Yeah.
week now, so we definitely can't do now. You have to have more time than that. You might want to go back to the college, but you still need to have 3 weeks rest. Can't go faster than that.
So
Because
like,
it's a major procedure involving the jaws, so it will take time to heal. So you can't go to some college and some food restrictions will be there, so it's difficult. Yeah, you
so
need
I
to
don't
give
think I
yourself,
can do it for another 2 days. Because
or you need to take leave. Yeah, you need to take leave from college, 15 days at least 15 days to 3 weeks. Can't plan earlier than that. It might look like a small problem, it's not.
because of post-op, like I'll have swelling everywhere and stuff.
Definitely. Definitely you'll have. It's like a jaw surgery, a proper full-blown jaw surgery will do.
Yeah, I'm doing MBBS in college right now.
Okay.
I'm final year and I'll have to. I have a year left the final year and then I'll have 1 year internship right now. So I don't think I can be able to do it.
No. The last patient also is a doctor. He's also doing internship somewhere, he said. But he said he'll come for 2 weeks. It depends, but without time we can't do.
I need a minimum of 15 days leave.
Definitely.
Okay.
Maybe more is better, because what happens after the surgery, already it's you'll be weak. Then I'll put you on dietary restriction. Again you'll get more weak. And then eventually internship means you'll run around. I know how internship is. It's not like sitting in front of a computer. So you'll be weak to do that. And people can faint and fall, or so it's not a great idea in 2 weeks. Better to give yourself more time.
So after surgery, I'll have to wear something like a liner or something like that. brace.
The braces will be decided by the orthodontist. We'll get the other person to come and see. He'll put some braces and all of those things.
But my jaw will be free after like the healing, like after 15 days. Or
Yeah, it should be better after that.
till like for the 15 days period, do I have to wear something?
No, nothing. I will keep some plasters from outside for 5-6 days.
Oh, okay.
Then we'll take it out.
So my best option right now is after 2 years or something, like after.
Whenever you want. See, it's all elective procedure. You decide around say.
Okay.
If you have time, let's say suddenly 2 months later, or you think you can get some permission to internship, or it all depends on how you plan out or schedule things, because it's elective. I can't say. Talk to your folks and see what your next plan is, because this requires some time. Thereafter you make a call. But in between, let's say you have 2 years, let me do braces in between. That is not a good idea. Just be like this, do nothing. Because what happens is then it can get worse. I've had many patients like that. Somebody tells them that we'll correct it with braces, and that looks and sounds like a good option. Obviously, right? Who would want to do a surgery if it can be fixed without a surgery? But when it's a bony issue, very often they never reach that goal, and patients are thinking they will reach it, and then you keep going through it, and at the end of it, when you come for surgery, that is actually you've gone to a place worse than where you are right now.
It's much easier right now.
It's easier now because it's virgin still, nothing has been changed. We have more options to manipulate your tooth further to the surgery when we need it. Or if you don't go for surgery, no harm, you don't look bad. See, if braces would solve the problem, I will agree. If you were 12 years, you could have tried. 21 years. ठीक है?
I'll let you know.
Yes, bye. You can let